Hi, and welcome to this presentation on guided self-help. Today we'll be talking about a type of therapy called guided self-help. We'll also look briefly at what cognitive behavioural therapy is and what to expect from receiving guided self-help in the service. So, what is guided self-help? It's a psychological therapy that you can do to help with problems such as depression, anxiety, and stress. It involves the use of self-help materials or computer courses, and it's guided or supported by a therapist known as a psychological wellbeing practitioner or PWP. It's based upon the principles of cognitive behavioral therapy or CBT, and it's sometimes referred to as low-intensity cognitive behavioral therapy. Guided self-help can be offered on an individual one-on-one basis, through an online computer course, or in a group setting. Your psychological wellbeing practitioner will work with you to help guide and support you through treatment. Each session will have a partner and will provide you with a set of tools to help overcome your difficulties. It's what we call an active form of therapy, meaning that you will be doing tasks between sessions to practice the skills that you've been learning. Depending on your difficulties and severity of those difficulties, guided self-help may be offered to you if this is your first time accessing therapy. It is suited to people with mild to moderate symptoms of low mood, anxiety or worry, stress, panic, various phobias, sleep difficulties, and also long-term health conditions. Guided self-help is based on the principles of cognitive behavioral therapy or CBT. The main idea with CBT is that our thoughts and our behaviors affect the way that we feel. It focuses on teaching tools and strategies that you can use in order to break out of a vicious cycle that can often maintain anxiety or low mood. It's a present focus type of therapy, and it does require you to apply what you've been learning in the sessions to everyday situations regularly in order for that to become a habit. In this slide, we can see what we call a maintenance cycle or a vicious cycle. This is something that would be presented to you early on in guided self-help treatment, and it helps us to understand a little bit about the vicious cycle that we caught in by looking at how our thoughts, our feelings, our behaviours and our physical symptoms are all linked. You may be offered guided self-help individually, online, or in a group. Individual one-on-one sessions are weekly, and they're usually between 4 and 6 sessions, which last for 30 minutes. Online CBT sessions take place through a program called SilverCloud. These are done fortnightly, and they are primarily done over the computer, but there are also telephone reviews done. Group sessions are also weekly for 6 sessions, and they last for an hour. Regardless of whether you do sessions online, individually, or in a group, you will become familiar with doing homework or tasks outside of the session to develop your learning from that session. Guided self-help frequently uses workbooks, leaflets, and various diaries. For example, you may read a booklet to help you understand the links between behaviours or activity levels and depression, and then use an activity diary to keep track of your own activities over the coming week. In summary, guided self-help is a low-intensity psychological therapy